Also tonight, we're learning more about the impacts this virus is having on our hospital system. We now know some kids who require medical care will be affected. This is a live look at McMaster Children's Hospital tonight, which now says it has to ramp down non-emergency surgeries and procedures. Top medical officials say hospitals in Hamilton need to take extraordinary measures to ensure they can keep providing care. Kelly Botello tells us more.
Hamilton Health Sciences and St. Joe's Healthcare Hospitals are feeling the pressure Omicron is causing and say the city is currently the epicenter of the virus in Ontario.
For what we can measure, the numbers have been higher in Hamilton relative to other health regions. And so, it's likely Omicron took off here a bit faster.
All hospitals in Hamilton have had to pause, to some extent, non-emergency surgeries and procedures. Top officials say it's because of extreme staffing shortages, as well as an influx of sick people arriving at the hospital, both COVID and non-COVID patients.
135 staff and physicians for McMaster Children's were in self-isolation as of this morning.
Children and youth patients at McMaster Children's Hospital will also have to wait for care that is not urgent, like 12-year-old Caden Willis, who suffers from obstructive sleep apnea and has been waiting for surgery since December.
It just affects every aspect of his life, and it, makes us worry because if he stops breathing for good, we won't know.
Caden stops breathing several times every night and is concerned that he now has no date set for his surgery.
It's really hard for me to know that I might not wake up the next day.
The decision to pause these kinds of procedures isn't an easy one, according to the president of McMaster Children's Hospital. But he says it must be done for the time being.
In order to free up highly skilled staff and physicians so that they can ensure that we're able to provide and protect critical care and acute care services.
Hamilton Health Sciences and St. Joe's say they are not currently calling back COVID-positive staff to work, but they do have a plan in place to do so should they find themselves in dire circumstances. Kelly Botello, CHCH News.